Good evening. On behalf of AIHA and the Twinning Center, thank you for joining us for this satellite session on twinning this evening. In line with PEPFAR 2 goals of strengthening health systems and expanding human resources, our twinning programs are targeted towards building the organizational and human resource capacity of key care providers, of also health-related education institutions, the universities, the schools, and governmental and community-based organizations addressing HIV/AIDS.
The partnership has developed a school-based HIV prevention program for youth between ages 11 and 14. So far, 3,724 teachers have been trained. Since 2005, the partnership has conducted 26 quarterly exchanges to Chicago or Nairobi. The exchanges allow for the provision of hands-on technical assistance, training on relevant emerging programmatic issues, and monitoring and evaluation sites visits. The exchanges also allow for technical assistance in building capacities for expert faculty and staff across the entire university.
Secondly, developing human resources for health by rapidly expanding pre-service, in-service, and clinical education programs to increase the pool of trained providers, managers, and allied health staff necessary to deliver quality HIV/AIDS care and other priority health services to patients and their families.
Partnership activities that took place are mainly student-to-student interactions, exchanges in study material and curricula, support meetings and communication between the three universities, as I had alluded to in the beginning, and the development of the honors program. The importance of the partnership exchanges, I believe, is mentorship, and it also accelerates development of a profession right now as clinical associates, and sharing experiences or expertise, and enhances the educational quality of both parties.
Twinning partnerships, third, are also focusing on strengthening the health and social services professions on a national and regional level by building the capacity of professional associations, accreditation and licensure bodies, and other supportive systems.
This is a Tanzania kind of approach that we developed. It's really what I call the three-legged model. There's a lot of work with the schools, and the schools see these partnerships as opportunities to strengthen their capacity or even to develop degree and certificate programs. In Tanzania, we've developed a consortium of schools that we're trying to help develop social work education programs. And then there's the need to develop a professional network and a professional association, and so that has to do with association building. But the third leg, which I think is particularly important, has to do with how do you actually directly improve services for vulnerable children or people with HIV, and that's what we've come up with as a parasocial work approach.
While the institutional focus may have shifted, the twinning model that's been refined over the past 2 decades remains the same, whatever the type of institution being twinned. At the heart of the methodology lies a focus on organized bilateral exchanges. These professional exchanges allow for practical technical assistance between peers from counterpart institutions in accordance with a well-developed but flexible long-term work plan. This foundation in long-term institutional relationships and extensive peer professional exchanges incorporated with with a very organized, results-oriented framework has proven to be especially effective in strengthening institutions and developing human capacity. The proof of the value of the twinning methodology lies in the results, of course, but collectively, at least in this one overarching indicator, the number of health professionals being trained by twinning supported education programs under the center, now more than 22,000 health and allied professionals having been trained since 2005. And perhaps more importantly, the capacity being developed in each of the countries to take that number moving forward after we're long gone.